Hi everyone, this is Dr. Kusuma from Suria Cosmetic Surgery. I posted phase 1 or part 1 of a video on upper eyelid surgery to explain some of the things that I wanted to share with the patient base audience at large, because we were discussing the different types of incisions and why and how it impacts the outcome. So this is phase 2 video where I'm actually going to show you some examples of before and after pictures to show the basic effects and differences of the different techniques. Okay, so let's just go and zoom in on this iPad. All right, so in order to demonstrate what I wanted to show, I'm only showing the right eye of patient 1, the left eye of patient 1. On patient 2, I'm only showing the left eye, and on patient 3, I'm only showing the left eye. So right now, let's just focus on patient 3 here, okay? Since I'm zooming so much, it may be a little bit blurry, so pardon me, but I think you can tell that there's excess skin, the lashes don't show, there's just heaviness all around the upper lid in this particular patient. Well, this patient underwent an upper lid bleph where there's a little bit of improvement you can see in the upper lid right here. Just focus on this side, but you can still see this extra overhang, the sharp turn, downturn here, and all of this still looks like it's heavy skin compared to that. So there is improvement, but is there a way to make it even better? So this is a patient that I got online, random person, without any identifiers, just so that I can demonstrate. So this is a patient that had a traditional upper lid bleph done, I believe, and I don't know who the surgeon is, I don't know where this patient is, I just showed the eye only. And I did not do this surgery, but this is a fairly standard upper lid bleph that is done. Now, I personally think this is still heavy. There's still this overhang on the side that doesn't look, I would really love to make sure that this is as sharp as possible, and that's my preference. And in order to show the difference, I want you to now focus on this patient here. So this is a patient of mine that I want to show. Similarly, she has a very heavy outer corner here that drags it down, and when anything drags down, it looks sad or tired or not as bright, not as happy, not as cheerful, not as youthful. So this heaviness people hate outside here. A lot of people look at the the little crease here where there's a nice crisp line there, but this area is ignored because oftentimes, as I explained in the video number 1, most people cut off the incision right there, so all of this still hangs. And you can see her post-op result here. You can see the incision is hidden nicely. All of this is gone. If you compare it to this heaviness here, all of that is gone, and look at how nice the corners of the eyes are. Crow's feet are gone. They're not going to develop as prominently because, as I explained in video 1, a lot of that muscle has been removed. And you can see the incision blends very nicely in about 4, 5, 6 months. It's hardly visible, and I'm blowing it up as much as I can, right? It's not barely visible at all. And you can see how clean this area looks compared to that heaviness right there. If I had not done that, I could not have gotten this result. So this is the right side. This is the left side, same thing. Completely cleaned out there. All that heaviness is gone, and there's none of the downturn look that the patient has. So the left one, again, to demonstrate asymmetry, preoperatively the patient has a lot of heaviness that's more than she does on the left side. So even naturally, there's a difference in the eye creases because that's what it is. Breasts are different, eyes are different, nose is different. There's asymmetry everywhere on the different hemispheres of the body, right? And you can see postoperatively, very nice crease, and this entire hooding is completely gone. This is the power of the technique that I described in version 1 or the part 1 of the video. This is patient number 2. My patient again, I'm sorry this is a bit blurry because I'm blowing it up. You can see she's got a crease, but it's not sharp and crisp. But here, I've merged that look where there's just one crease, and the corner again, there's absolutely no crow's feet or no overhanging skin, and the turn pretty much ends where it should end, and there's no additional turn like this patient that kind of comes down and swoops around here, because this makes people look heavy, tired, and this skin, since it's so thick, it just feels heavy. And I've heard so many times people come and say, "Doc, I still feel I had the bleph, but I still have this heaviness there," and I do revisions on them. So wanted to showcase all 3 of them. So I want you to study this result, which is a traditional upper bleph. Improvement, but not enough in my opinion. Random person, I did not do this surgery in this corner. This is the problem I'm trying to solve. Here is how you solve the problem. You can see how much cleaner the crow's feet area looks with the technique that I'm talking about on the right side. and on the left side, and this is patient number 2, exactly the same thing, which I think demonstrates the power of this technique. And in my opinion, this eyelid incisions need to change. I think it needs to evolve. And if there's any issue with the incisions at all, you can certainly improve them even further with laser resurfacing or some other skincare techniques that makes it pretty much go away. And so I'm going to do part 3 of this video next series, where we're going to put together the actual surgery step by step, so you can see how the surgery is done in the operating room and what they look like immediately after surgery. So thank you, and I hope that makes it clear.